Good evening. My name is Dr. Robert Baric from My Brain Doctor. I'm board certified in neurofeedback. I've been a chiropractor for over 25 years, and I'm currently getting my board certification in traumatic brain injury. So I know a little bit about the topic we're going to be talking about tonight. So let's kind of go to quickly. I'm going to cover what happens in a traumatic brain injury. And that can be something as simple as a fall from a skateboard, or an automobile accident, or a sporting injury, or a fall in the bathroom at 3 a.m. And all of those are very potentially detrimental to the individual. And the problem occurs is it's sometimes how you feel immediately, but people change. In the world of neurofeedback, people will come in, individual come in, a young man, a woman, and I'll start talking with them and their parents, and they'll say, oh, well, the anger and the anxiety really started 2 years ago. And I'll sit down with them and I'll say, well, when was your concussion? And they'll say, well, I didn't have one. And then I'll say, okay, 2 years ago, plus usually 2-3 years. Tell me about your concussion in 2015. And they'll say, oh yeah, I did have an auto accident, or I was in a sporting event, or I did fall skiing, or something insidious, and they really don't connect back to it. So there's so many residual symptoms that can come from concussions. Yes, they can be traumatic immediately, but oftentimes it's the residual that steals your focus, or anger, or depression, anxiety, so many of those complicating factors, which we're going to cover quickly. So let's jump right into it. I want to talk about heads up. And I need to get my mouse because I'm using 2 monitors, and I apologize. Heads up. So first of all, qualifications: certification of completion, CDC, heads up, safe brain, stronger future. This is a great program. You can do this online. If you're a coach, if you're involved in sports athletics, or you have somebody, it just gives you a nice, very brief, high-level overview of a concussion and really understanding the basics of a concussion. But now let's get into the really detail. What happens in the brain? And what happens in the brain is you have this injury where the brain kind of sloshes back and forth. And the head weighs about 15 pounds, and the brain is basically soft butter. And axon members are damaged, potassium comes out, calcium, potassium freely flow in and out of the cell. Calcium damages intracellular function, cellular hypoxia, which means it loses oxygen, brain forced into, and this is where it's very interesting. Your brain weighs 5% of your body, but it consumes 25% of your calories. But what happens is when your lactic acid, when your glucose can't live with that, can't supply that energy demand, we start to get lactic acid building up, blood-brain barrier breaks down, inflammatory process, and then we really get a large flood of neurotransmitters. And this is the beginning of the rock slide. This is the beginning of the avalanche to many, many things. And symptoms to look for. Well, we're going to look for dizziness, balance issues, pupil asymmetry. And that number 2 is really where the technology is taking us. There's now abilities to look at the eye with apps, and you see how your pupil reacts. And it's called dysautonomia. And dysautonomia is a big word for your sympathetic and parasympathetic nervous system not in sync, right and left. So one side of your brain is running away from the other. That causes vomiting, nausea, gait disturbances, headaches, disorientation, fatigue, and then sleep disruption. But again, remember, I wasn't hurt. Yes, you were. You were hurt. So pre-screening options. And this is kind of the individual that says, all right, I'm going to go do athletics. I'm going to go do biking. I'm going to go do something that's setting me up. And you have options of like doing computerized testing, pupillary constriction testing, and that's called Right Eye. It's out of University of Indiana. And what that does is that gives us a baseline, how quickly your pupil contracts when a light is, and then when you shut that light off, how it opens back up, and vice versa. So we see when the light is bright, it contracts, and then you shut the light off, it opens. QEEG, amazing pre-screening option. Here's just a real quick on Bright Eye. Bright Lamp is Indiana University, and it looks at how that pupil reacts. So now we're in a mess. We have an individual that has a concussion. Well, how do you define a concussion? Squishy as all heck. There's no magical blood test. There's no indicator that says you have one or you not. But it's more of a symptomatic. It's looking at the eyes. It's looking at the symptoms. And extremely important last thing is when looking at treatment of a concussion, the latest working papers called the Berlin documents, they took the experts of the world several years ago, and they basically said, what is the best progress in doing this? And not only is it the head, but it's the cervical spine or the neck. So super critical in this. So let's talk about neurofeedback. That's the purpose of today. Neurofeedback started in 1965. Why? NASA was having problems with astronauts having seizures. Neurofeedback is a method of training the brain waves to alter the structure and function of the brain. And that's the key. We're altering both the structure and the function. And when we have a concussion, we have altered structure and function. And we need to correct both of those things. Used to help people with TBIs, traumatic brain injuries, anxiety, ADHD, depression, and many other symptoms. A drug-free, non-invasive process. Okay, so, and we talk about process, and process is the key. And I get calls weekly. Well, I have anxiety, or I have a traumatic brain injury, I had a concussion. What do you do, doc? And I say, all right, so the first thing is you need to evaluate. And evaluate is we do a thing called an EEG. We put a cap on the head. You're going to see a picture in a minute. And we listen to the 18 voices in your brain, eyes open and eyes closed. This is a medical grade EEG we do in the office, because we don't know what's going on until we see what's going on. And then we're able to analyze those results. From the analyzing the results, we're able to compare that to a normative database. And we're going to get into that in a little bit. But first of all, it's gather data, analyze the results, and then you actually see, does the shoe fit? If the shoe fits, fabulous. This is something as a consideration for treating a concussion. If the shoe doesn't fit, well, it's a non-issue, right? The shoe doesn't fit, let's not try to jam it on the foot. Then it's neurofeedback, which is operant conditioning. Operant conditioning, real world, is called puppy training. Puppy training is when the brain's doing what we want, we reward it with television. And when the brain does not do what we want, we ignore it. And we're going to get all into these into much greater detail briefly. And then symptom results. That's the key. The key is a woman that just left about approximately an hour ago, and she's chatting with me about her entire, not only is her son better, but her entire family is better. She's able to communicate with her son. She's able to talk. This was an individual that was good. He had a concussion, massive issues with scolding, massive anger issues, massive confrontational issues, disrupted the whole family. And now she's able to talk with him. He's able to be rational, and just really a light bulb, a totally whole family transformation. So let's break these steps down. You'll see this young man has a cap on, and basically his eyes closed, and every one of these white buttons are electric wires going back to our computer. So it assesses brain problem areas, it's non-invasive and painless, and it's fast and accurate. And that's the big thing. People say, well, I had a concussion and I had a CT scan. Super important. Those are very helpful because it makes sure your head is not bleeding on the inside. If it bleeds, you can cause called a subdural hematoma, catastrophic. People die of that. Well, they're extremely rare, but again, they have a space. But unfortunately, when you do a CT, when you get many exposures of X-ray, and this is not it. But this is gathering functioning how the brain is. CAT scan doesn't show good or bad. If you're bleeding, it shows it. If it doesn't show anything. Whereas this is where we're test driving the car. We're seeing how the brain's doing with its eyes closed and eyes open, and we get a weather map. And that weather map basically is going to look like the United States weather map, but each one of these spots we're going to go over in a minute is very characteristic of a different. It's a powerful tool, and it tells us what's going on inside the brain. So oftentimes we'll get these F3, F4s involved, which will be anger, short-term memory, F8, working memory, or a woman we're working with a stroke. T3 is involved. This is language comprehension, verbal understanding. So this area of our brain. But a concussion, depending on what the angle is it a front back injury or is it a side to side injury? It can present in very, very different ways. So the second is we assess that data. And if we look here, this top one, this is where a stroke occurs. You can see how it's very different right to left, but you can see how these different colors mean different things depending on where they're at. But the brain shows abnormalities. So we're analyzing the results. Now, here is where the massive improvement has occurred. We take that, your specific results, and we compare it to a 500,000 person database. And then after that, I sit down and I review one-on-one with the individual and the whole family or whoever's involved and say, this is what we found from the examination. From your data, this is what we found. We see what's going on with you, and then when we compare it to this normative database, and it's so critical because now I have a, how are we doing? Where are we at on this continuum? We review those scans, and it's very important because this is a big, again, I can't overemphasize, if the shoe fits, try it. If it doesn't, many people, probably 10 to 20%, are not good candidates. And if they're not good candidates, this is where the storyline stops. And so we're able to respecting time, an individual's time, respecting an individual's money. Why? Because they're not both unlimited. But again, it's that when we analyze the results and we sit down with you, I'm fine to tell you that you are not a right solution. This is not a right solution, and try to get you to the right solution. But I'm also fine to tell you this is the right solution. And that's why we have all this expertise using the absolute latest equipment to be the expert in that. That's why I'm working on that board certification to bring in those extra skills. So what is neurofeedback? Individuals are connected to the computer using sensors, and you see these sensors here. So an individual comes in, and these are listening. They're listening to how the brain's functioning. The computer reads the brain waves. The brain waves begin to appear properly in the computer, and we're looking through operant conditioning. So we're teaching the brain how to do it correctly. How are we doing that? We're rewarding it. So what is reward? Behaviorism, riding a bike. We're teaching the brain how to function correctly. And when the brain gets to that functioning correctly, it's a learned skill, like riding a bike, 30 plus years. So if we look here, this is a brief video. We're going to see some lights flashing right by her eyes. And these are just reinforcing what the brain is learning. And then we're going to spin over, and you see how the TV's going in and out. When the TV is nice and bright, that's saying, good job, good job, good job. And when the TV gets darker, it's like, hey, we need your attention back. So we don't shock them. It's only a positive reward-based system. But that positive reward is so critical because the brain quickly learns, oh, when I get my waves where I need them to be, according to that normative database, FDA approved, that is where I can get the wow factor. That is where I can get those wow results. I can get those waves back in, not only help them get back into where they should be, but basically think of it as the brain screaming, and we get it down to a talking level. We don't want it whispering either because we can't hear it. We want to get it to the volume that everybody can hear. Symptom results. Each session takes about 30 minutes. Total of 40 sessions is usually recommended. An individual with a stroke today is 100 sessions. But here's what makes it very unique. We work 20 sessions and we rescan. So we see that difference, 20 sessions, boom, 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 rescan, see how we're doing. Sessions are at least twice a week, open 4 days a week. Some people come in 3 times a week, sometimes 4 times a week. And so there's two really break points. The people around the individual start seeing a difference about 5 to 10 sessions, but that individual 90% of the time starts seeing the difference at about 10 to 15 sessions. Wow, I can stay focused. So rumination is I can shut my brain off of at night. Panic attacks. And this is a pre-post. So the gray is where we started and the colors are where it's at when we stopped. Verbal impulsivity is better. Shifting tasks is better. Perseveration. Panic attacks, hypervigilance, focus, filtering. Wow, that's a big one. Episodic memory, emotional impulsivity, easily distracted, dislikes novelty, depression, attention, and anger. Huge improvements. So now we get into some successes. Depression, 75% peak performance. Concussion is 60. Why is concussion 60? Because it's so multifactorial. As I said, the Berlin study says the neck is involved, very important. There's individuals that choose us to look at that also, but there's a huge nutritional component too. So there are many, many factors that can complicate that, but 60%, again, very impressive. Autism is a range. ADHD is 80%, peak performance is 90. So neurofeedback is tuning up your brain, tuning up your car, tuning up your teeth. Why? You don't want a root canal. So let's jump into some research here. Clinical EEG, what they did is they looked at 40 cases with post-concussion syndrome. 39 subjects were followed up on a long-term following of 3.1 years. All but 2 subjects were stable and were off medication. Overall, neurofeedback treatment was shown to be effective in this group of subjects. So what these are people that had symptoms that persisted greater than 12 months before they started the study. And 39 subjects were followed up for long-term. Huge improvements, and we're using the different questionnaires, the Clinical Global Impression Scales, the Hamilton Depression Scale, Minnesota Multiphasical Personality Inventory, Variables of Attention. So these are all baseline questionnaires that you do at the beginning, you do in the middle, and you do at the end, in addition to getting feedback from that individual. So an amazing study showing great results. It's very recent. And then another one, clinical and biochemical outcomes following EEG training of traumatic brain injury, spontaneous recovery. So this is, we looked at 60 patients, 30 patients with neurofeedback and 30 patients with the usual tau group, and half of the patients were recruited within 6 months of injury. And the alpha theta neurofeedback, which is a different form of neurofeedback, but very, very beneficial. The other one was doing 2-channel, that's way in the weeds, but that's what we usually start off with people. A symptom reduction as well as perceived stress. Also had a beneficial effect on levels of serum cortisol. So again, another great study showing that the traumatic brain injury is a very complex thing, and how that brain gets jiggled around really can have a big factor in how that individual presents, and that's where the more tools in the toolbox is just so important. So let's talk about some current best practices. Well, if you have the ability and you're going into, your child or yourself are going into sports, to get that pre and post comparison is huge. Is that an electronic test? Is that an eye pupil test? Is that a pre-EEG? That's awesome. But once life-threatening assessments have been ruled out, we need to look at that complex gait assessment, pupil constriction response, that QEEG we talked about, cervical spine status according to Berlin study, autonomic dysfunction, and again, that's how are the eyes opening? So when we shine the light in, do they both contract, or does one contract? And then vice versa, when we're moving the eyes, when their head is still and we're moving the eyes, and does the eye move and then the other try to catch up, or do they both track normally? And then vice versa, when we move the eyes and the head, do they stay in their spot, or do they kind of get fixated and try to catch up? And they're called saccades, and they're a very good indicator of dysfunction in this massive symphony that goes on in our head for eye tracking, for movement, for gait, and when that's in dysfunction, all kinds of fits occur. Is that mental focus, anger, sadness, sleep deprivation? All of those initial symptoms are very functionally disruptions. And as I said, well, I wasn't hurt in the concussion. So yes, we definitely can get symptoms immediately, but there are many people that have the concussion that, well, yeah, I'm fine. Well, no, they're not, but they kind of were able to get back to close to normal. But unfortunately, 1 year, 2 years, 3 years, 5 years, they start getting symptoms, but they don't connect that back to that head bump, that head trauma. So, to kind of in summary, imagine your life without your concussion symptoms. Why is this so critical? How do you train your brain and change your life? In England, they looked at homeless people, and they're homeless individuals, and they sat down and they said, what happened in your world? 5 years ago, you had a job. 5 years ago, you were working. 5 years ago, you were living in a house or a flat apartment. What happened? And 50% of them, close to them, had some concussion while they were functioning in a normal life. And over time, their life eroded. Wow, I was angry. I got thrown out of my house. I got divorced. My kids left me. All of these things occur because that delicate symphony that needs to occur in our brain gets out of function. And when it gets out of function, our life doesn't function. Our brain doesn't function. I'm working with a gentleman, and he says, he's 63 years old. He says, I haven't thought this clearly in 40 years. So when you tune your brain up, that allows you to get back to not only how you do, to give you that self-confidence to how you feel, but it's also how do you interact with your loved ones? How do you interact with your coworkers? How do you interact with your family members and your neighbors? those are just so critical, because when that's in dysfunction, it oftentimes leads to stress that we really don't need. And it really is very disruptive to our life. I thank you again for your time. My name is Dr. Robert Baric. As I had said, I'm here to help you. I've worked with concussions, both loved ones, others, and it just gives me unbelievable satisfaction in helping getting your life back to the way you always knew you could lead, but that this traumatic brain injury, this concussion, bumped us off the rails. Have an amazing day. Thank you again. Be well, be safe.